A lot of women are concerned about their fertility declining with age. You're born with all your eggs and your fertility does decline over time, and particularly after the age of 35, not only have you lost egg numbers since you were sort of going through puberty, but the egg quality also starts to change. And that's a particularly worrying feature and is what's prompting quite a lot of women to come forward and do what is often known as social egg freezing. So what does social egg freezing involve? It involves really first having a fertility test to assess your egg reserve. So that involves having an ultrasound scan of your ovaries to measure the volume of the ovaries, the appearance of the ovaries, and also to look at the number of tiny awake eggs that you've got in your ovary. They sit in little sacs of fluid called follicles, and we call it your antral follicle count. And we also measure a hormone which is normally in sync with that sort of awake egg count, and that hormone is called anti-Müllerian hormone, or AMH. So we measure antral follicle count and AMH and follow this up with a consultation with one of our fertility experts to just talk through your wishes, talk through your medical history, as well as discuss the results of your test. And then we can plan a treatment cycle and follow that up perhaps with a nurse consultation where you can have further questions answered, and we can encourage you to be prepared for your cycle. The actual egg-free cycle involves taking some hormonal injections over a 2-week period. Normally it's sort of 10 to 14 days. You don't need to come in for those injections. We'll show you how to do them yourself. They're very easy. They're just small subcutaneous injections just under the skin. And we will arrange for you to come in 2, 3, 4 times during that 2-week period to have monitoring to look at how your ovary is responding to the fertility injections, how the little follicles are changing from being quite small, usually sort of 3, 4, 5 millimeters in size, through to a size where we can know or feel reassured that the egg is likely to be mature, and that's when they get to about 18 millimeters or more. And at that point, we'll ask you to take a trigger injection. That's a particular type of hormone that will prepare you for the egg collection, which takes place around 36 hours after that injection. So the egg collection takes place here at one of our clinics, where you will have, first of all, a chat with one of our consultant anaesthetists, as well as the consultant fertility expert who will be doing the procedure. And you'll have some sedation, something that will make you relaxed. And for most people, you'll be, they find they're asleep and don't remember any of the procedure. And it takes about 10 to 20 minutes to collect the eggs. During the time you're asleep, you'll have an internal ultrasound scan, and that will allow the consultant to place a very fine needle, goes through the top of the vagina into each ovary to collect the fluid that's inside the small follicles, and those little sacs should all contain an egg. We use your egg reserve test to actually get the dose of medication right for you, individualized to you, so that we can make sure you don't over or under respond to the medication. You get just the right response to get a healthy number of eggs. Not all the little follicles will necessarily contain eggs, and not all the eggs will necessarily be mature. So once we've finished the procedure, we'll take you through to the recovery bay, where you'll have something to eat and drink and then go home. You do need somebody to collect you and look after you for the rest of that day. And meanwhile, in the laboratory, we'll do what we call stripping the eggs. We'll take the small surrounding cells away from the edge of the egg, and then we'll be able to judge if the egg is mature and can be frozen. And you should get a phone call later that day to tell you how many eggs have been successfully frozen. Now, for some people, a single cycle of egg freezing will generally produce quite a good yield of eggs, and for others that may need 2 or 3 cycles, and it all does depend on your egg reserve as well as your age. So we know with egg freezing it's terribly important to factor in age, because if you're under 35, we'd probably encourage you to freeze around 20 eggs, which is giving you a good chance of having at least 1 child in the future, possibly 2, probably greater than 85% chance. But if you're a little bit older, we'd probably encourage you to collect more eggs and freeze more eggs. And there's no precise magic number that can really be giving you a 100% guarantee, because that's the unknown about egg freezing. We don't really know what that egg is going to do when it comes to face sperm and has to go through the process of fertilization and then growth to become an embryo. But our aim with egg freezing is to give you some reassurance that you've done everything you possibly can in preparation for future parenting, and that you haven't left it too late when we know your fertility is going to perhaps have declined and your egg quality has also declined.